You are here this evening because you have a heart for kids. My name is Dr. Rosemary Taylor, and I'm a board member and a clinical psychologist in private practice. We are excited that you are joining us for this training led by Children's Advocates for Change. Tonight's focus addresses advocacy for youth, mental health issues, and the resources that lend support. You will hear about strategies for the greatest reach and learn concrete action steps for addressing legislative issues from our guest legislators. We all have varying degrees of advocacy experience. In these challenging times of advocates of remaking the human resources landscape, as people who work with kids in our communities and houses of worship, we must be well-informed advocates for greatest impact. Thank you for caring and daring to be this advocate. Mitch Lifson with Children's Advocates for Change will start our training now. Thank you.
Thank you, and good evening to everyone, and thank you for joining us. You might be familiar with Voices, United Voices for Children. If not, it is a coalition of groups and individuals within the Northern Illinois Conference of the United Methodist Church, dedicated to speaking and acting on behalf of children, youth, and their families who need the voice of an advocate, as well as to nurture and support ministries of the conference. Children's Advocates for Change is an independent advocacy organization committed to the well-being of every Illinois child. We champion those policies and investments children need to be educated, healthy, and thriving. So here's an agenda for this portion of the program. First, we'll define advocacy. Then we'll go through the structure of making an advocacy pitch. Those elements being identifying the issue, clarifying the issue, identifying the audience, that is, who you talk to, communicating your issue with a story or data to emphasize it, making an ask, and the follow-up with an elected official. If you looked in the dictionary, you might find the definition of advocacy as the act or process of supporting a cause or proposal. In essence, what you are trying to do is raise awareness about an issue. You're looking to influence and change policies. You may be looking to represent individuals who may not be able to speak for themselves. The difference between advocacy and just having a general conversation is that there is an ask. You're looking for something to be done, and you're asking for someone, usually an elected official, to take that action. It may be a request for action to occur, such as passing a bill. It may be a request to oppose a measure that you may see as harmful to your cause. This video helps provide the definition of what is advocacy.
What is advocacy? It'd be easy to think that advocates are out in the political world, separating right from wrong, us from them. But it'd also be incorrect. Advocacy provides a voice for the community to inspire system-wide change. It puts the views of those who need to be heard in front of those who need to hear them, in hopes of seeing a better world for all. And it's working. Because of advocates, Americans have better access to safe drinking water, health care, equal work opportunities, and so much more. But they weren't alone. They had support from a community that cared about these issues and wanted to see a change. a community full of people like you. So why support advocates? Because advocacy is an essential part of leaving this world better than we found it. What is advocacy?
Now, there is a difference between advocacy, excuse me, there is a difference between advocacy and lobbying. As a general rule, advocacy is arguing in favor of a cause or an idea. You might want more after-school programming. You might want to get more economic resources for members of your church. You might be seeking more youth mental health services. Lobbying, on the other hand, takes two forms. In the first form, direct lobbying, it's an attempt to influence new or existing legislation via communications with a member of a legislative body or with a government representative who has a say in the legislation. For example, you make a direct ask of an elected official to vote for Senate Bill 57. Grassroots lobbying is when you ask the general public to contact their legislator and or mobilize the public around a legislative issue. Now, in general, an individual on his or her own, not paid to lobby, can lobby for an issue. It's somewhat different for an organization. Most churches may be classified as tax-exempt organizations under Section 501c3 of the Internal Revenue Code, defining nonprofits. Other organizations may specifically apply to the IRS for tax-exempt status. In 1954, Congress approved an amendment by Senator Lyndon Johnson to prohibit 501c3 organizations from engaging in any political campaign activity. But if you are a 501c3, you can't engage in partisan political activity, and you do need to be aware of some restrictions on your overall expenditures, that is, how much you can spend on lobbying. In short, you need to ensure it's either an insubstantial amount or your overall activities are within certain designated limits. If you're paid to lobby, you may need to register as a lobbyist. We have arranged with the Alliance for Justice for a future presentation for those who want to learn more about the restrictions. But overall, this should not deter you from advocacy. You're free to do as much education to the general public or an elected official about a particular issue that you want. And education is really the crux of this. You are an educator. A legislator may not be familiar with your issue. Even if a bill is filed on the subject, he or she may still not be aware of it. There are thousands of bills that get filed for each session of the General Assembly on a host of issues. And during a week in Springfield, legislators may see scores of people on different issues. So you want to bring your issue to their attention. Sometimes an elected official may only be able to give you 5 or 10 minutes for a visit. You want to make sure your pitch is as effective as possible. And here are some key elements to making your pitch. You want to identify the issue. That is, what did you come to see the person about? You want to clarify the problem. You want to identify your audience. You want to communicate your issue with a story or data to bring it more to life and create more emphasis. And you want to make sure that there is an ask of the elected official. Defining the issue. What is it that you're in front of the elected official to talk about? For example, are you there to talk about more services to help youth deal with mental health issues? Are you there for steps to reduce the teen suicide rate, reduce child poverty, or reduce child substance abuse? And in many cases, you may have identified the issue, but it still might be very general. What specifically is it that you want the elected official to do? Do you want to increase the number of school counselors? Do you want to increase funding for a suicide hotline? Do you want to provide additional state support for SNAP benefits to supplement what is in existence so people can deal with grocery prices? Do you want to double the number of treatment beds in a county? Now, you may know the issue you want to address and what you want done, but who would you talk to about this? Is this a city, county, state, or federal issue? Perhaps before approaching any elected official, you want to reach out to others in your church or community to make them aware of the issue, and then, as a group, seek a meeting with an elected official. If you know what level of government needs to act, who do you see about it? Who are your elected officials? Well, several internet sites can help you out with that. If you go to the Illinois General Assembly's website at ilga.gov, you'll see in the bottom left-hand column a designation of legislator lookup. If you click on that link, it will take you to the State Board of Elections website where you can enter in your home or business address, and then you'll get a list of elected officials with contact information. Similar sites usually exist for local government bodies, such as the City of Chicago's website, which will help you find your alderperson. So you know the issue you want to discuss with someone, who to speak to. Now you need to put together your presentation. You want to amplify your request with a story or data that reinforces your stand on why action is needed. If you're willing to tell a story, it's a great approach. It is difficult to overstate the importance of a good story. Compelling personal stories are generally essential to any successful advocacy campaign. People connect with these stories on a deep level. It's one of the best tools to change people's minds or strengthen their support. The more detail you add to paint a picture, the listener will remember, and thus the more effective the story. Thomas S. is a 19-year-old who attended high school in the northwest suburbs of Chicago. He believes high schools need to do more with regards to available youth mental health services. Here, he tells a personal story to illustrate his viewpoint.
I spent about 2 years in and out of psychiatric facilities at the end of my high school years. And I would say the services that the high school provided were not adequate. And like what I mean by that is the first time I think I went to my advi or counselor with issues about my mental health was freshman year. And I told her, I'm feeling a little bit depressed. I don't really know what to do. I don't know who to go to. She just kind of brushed me off. And she was like, well, let's talk about your grades. Let's talk about your classes. Um, and so I was kind of left without help for 2 years. And like the problems just escalated. Um, and, I kept reaching out to my counselor, but, nothing really worked. So I ended up in the hospital. And after I was in the hospital, that's when I finally got access to resources, like peer-to-peer support groups and things like that. So I felt like it was really wrong that this situation had to escalate to a certain point before students had access to like these resources that would help them. Because I also heard that from other students too, like my friends, they would go to their counselor and say, I'm feeling really terrible, and they wouldn't really get any help. But the moment they would say something that's like, objectively alarming and something that they're forced to like report, right? Because they're a mandated reporter, like, oh, my parents are abusing me in this way, or I actively think about suicide, then it would get escalated to the next level. But until that was mentioned, like their concerns were not taken seriously at all. So I did not want to involve my family into it too much. I didn't want to put that stress on them. And I wanted to go to somebody that I knew was paid to deal with me, like paid to, and they were qualified to deal with these problems. And so I thought that that would be somebody like my counselor. At least that was like my first point of contact. I also just I couldn't make sense of my own head at that time, like myself either. So I was like, I need help. Like before I can even go to my parents, I don't even know what I would say to my parents. I would just say like, I feel bad. And they would say, why? And I would say, I don't know. And so I wanted to go to somebody who could help me kind of unpack that before I went to my parents. but I never really was able to get that unpacking help. Um, because it wasn't really taken seriously. And it was only taken seriously when it escalated to a certain point. And at that point, everybody just, freaked out, and it wasn't much help. Um, and so, no, I wasn't really able to go to my parents because I was hoping that my counselor would kind of aid me in opening up to my parents and doing that in like a healthy, um, effective way, in a way that wouldn't cause a lot of fallout. I
Now, data can also be very compelling to your argument, especially if the data provides some startling information or stark contrast. For example, in 2021, data showed nearly 3 in 5 US teen girls felt persistently sad or hopeless, or nearly 1 in 3 teen girls seriously considered suicide. These are data points that elected officials may well remember. You may also wish to put together a fact sheet, which you can leave with the elected official, that has data regarding your request. Above all, you want to make sure your issue is relatable to elected officials and present your issue either with a story or data in a way that elected officials will remember it. The objective here is to get the action that you are seeking. You're out to win, not just educate. Here's a general outline for your presentation to an elected official once you have been able to establish a time for a meeting. You want to introduce yourself and anyone else who's accompanying you. You want to explain the purpose of your visit. What is your issue and why are you there to see the elected official? Explain via a story or data why the elected official needs to address this issue. What's your ask? What do you want the elected official to do? And then ask the elected official if you can count on his or her support. If the official's uncertain, ask if you can follow up with his or her office at a later date. And be sure to thank the elected official for his or her time. You want to be clear so that there are no misunderstandings about what you're talking about. You want to be concise. In a number of cases, particularly if you say we're to go to Springfield on a busy legislative day, you may only get 3 or 4 minutes with an elected official. So you want to be direct to the point. You want to be honest. Nobody likes to be lied to, and there's probably a very good chance that if in your first visit you lie to an elected official about what you're talking about, then you won't get a second visit. And you want to make sure that you're actively listening to the elected official to understand his or her concerns and perspectives. Follow up your meeting with a thank you note or email. If the elected official was non-committal to your request during a meeting, this is also an opportunity to see if he or she has decided whether to support your issue. Achieving a legislative victory may take more than one try and more than one visit. So it's important to maintain a good relationship with the elected official. And finally, I will just add that it is persistence, and it may seem daunting, but you should not underestimate your ability to change things. Change doesn't always happen with the first request. You may need to have repeated visits or calls, but you can impact your community and, depending on the issue, perhaps even the world. Now, we heard from Thomas. Next, we're going to hear from another young person, Nikki, age 20, who is from the western suburbs.
When I was in high school, I went into a mental health hospitalization program. And when I came out, I remember at my school there were no transition programs. I had to sit in class no matter what. There was no option. No matter how I was feeling, I had to be there, and that was tough for me. In my opinion, the resource that is most effective for students seeking mental health support in school, I think, for me, because of my experience, would be a transition program. I think there needs to be a specialist in a school who knows what kids are coming from and what they need to face. Because I think expecting more from them is irrational. When I was in school, for me, the hardest resource to lack was, I just think, someone who understood. In high school, I feel like there were a lot of opinions, and none of those opinions came from someone who had gone through what I had. Um, and I remember, as I was a student with mental health support, no one got me. Not even the people who were supposed to be supporting me. When I was in school and I had no resource support, um, I felt this pressure to be in school. I felt this pressure to constantly to be there, to do my best, to do what was expected of me if I did not have mental health issues. And for me, that was too much. I couldn't do that. I could not be expected to do that. Um, and it was unrealistic. And for me, I didn't meet those expectations, and I ended up going back into the hospital.
In just a moment, we will hear from members of the General Assembly with regards to their thoughts on what they see coming up in the next current, rather, legislative session on youth mental health issues. But first, we wanted to provide you with a little bit of the background as to the fiscal environment that these individuals are facing. So last November, as required by law, the Governor's Office of Management and Budget issued an annual report on the state's economic and fiscal condition. And that report showed that the upcoming fiscal year, which starts on July 1st, had a projected budget deficit of nearly $3.2 billion based on current revenue and expenditure projections under state statutes. And if you took it out to future state fiscal years, the report estimates a budget deficit in 2030 of $5.15 billion. In general, the office projects revenues will be flat, which could change depending on economic activity with new federal government tariffs or potential new tax cuts and income tax deductions. The projected expenditure increases are largely driven by healthcare and medical inflation, human services, group health insurance, and pre-K through 12 education. Some of you may remember that we revised the school aid formula in 2017, and the general pledge from the legislature was to try and add an additional $350 million per year to the evidence-based school funding formula. Now, as noted by the Governor's Office of Management and Budget, across-the-board spending cuts to the state budget would be difficult because of required debt service on general obligation bonds, pension payments, Medicaid requirements, and other consent decrees. And together, that represents about 40% of the general fund's budget. And then another 24% covers education spending. So also in November, Deputy Governor Andy Menard, who generally handles budget issues for the governor, put out a memo to state agencies asking them to review anticipated budgets for the fiscal 26 year and possible reductions. He said agencies should identify those programs that have increased in recent years, paying specific attention to additions in fiscal years 23, 24, and 25, and make suggestions for spending reductions. And at the direction of the governor's office, no legislation with an increased fiscal year 26 fiscal impact should receive state agency support. Now, all of this is before any federal spending changes to healthcare, childcare, housing, or other human services that could have a significant impact on the state budget. The Federal Office of Management and Budget issued a memo on January 27th to pause federal spending on various federal agency grants, loans, and other financial assistance. OMB withdrew the memo on January 29th. Judges have issued 2 separate temporary restraining orders. Still, some nonprofits are having difficulties getting paid. A continuing resolution, though, funding the government expires on March 14th, and Congress is looking at a tax package and significant budget cuts to fund it. So the new General Assembly has been sworn in. Both the Senate and the House have Democratic majorities. The governor is going to outline his thoughts on what the budget should be for the upcoming fiscal year on February 19th, and then the scheduled adjournment of the Illinois General Assembly's spring session is set for May 31st. So with that, Reverend Beal, I will turn it over to you and our guests to discuss the legislative environment.
Thank you so much, Mitch. Yeah, friends, I really would encourage you to reach out to Children's Advocates for Change. Definitely use their resources that are available on their website, and see about having them come speak to your communities. Mitch and Dr. Tasha Green-Cruzat are here tonight, and I really appreciate your presence and your leadership. So yeah, I'm going to shift things over. We've heard from his presentation some ways to talk to our elected officials, and one of the things he said was thank the elected officials for their time. So Illinois State Senator Laura Fine and Illinois State Representative Anna Moeller, thank you so much for being with us today. Laura Fine is the chair of the Senate's Behavioral and Mental Health Committee, and her districts represent parts of Chicago and all or a portion of Evanston, Glencoe, Glenview, Gulf, Kenilworth, Morton Grove, Niles, Northbrook, Northfield, Skokie, yeah, Wilmette, and Winnetka. Thank you for being here, Senator. And Anna Moeller is the chair of the House Appropriations Committee for Health and Human Services. And her district includes portions of Elgin and Carpentersville, East Dundee, Hoffman Estates, and Streamwood. So I've got 4 questions for our representatives. So the first question that I've got for you tonight is, what do you want from constituents? So when we bring our concerns and our issues to your attention, do you have pointers for advocates on how we present our issues to our legislators? Help us out. And I'll invite State Senator Laura Fine to respond first.
Thank you so much for having me here tonight, and thank you for this discussion. I appreciate it. I love when people ask me how to reach out to your legislators, because we want to make sure that we hear what your needs are and what your concerns are. I would say start reaching out to your legislators possibly over the summer, or when we're not in Springfield, and develop a relationship with your legislator. So then when you do come back with an ask, we know who's asking it, and you're comfortable picking up the phone or sending off an email, knowing that we've had this one-to-one interaction already. So that's how I would start. When you do reach out to us, reach out with kindness. Like was said in the presentation earlier, there are, gosh, Anna, how many bills were there? Like 6,000 bills filed this year. So we try to keep on top of everything, but it's very helpful when you come to us, put something on our radar screen and give us a personal story of why that bill is so important. And then I'll let Anna pick up from there.
Thank you. Well, first off, I just want to say thank you for having us. I think Mitch did a magnificent job doing an overview on the importance of advocacy and how to be a great advocate. Thank you, Reverend Beal, for having us here tonight. I just want to throw in a personal note. I was raised by my grandparents in Waukegan, and so the mission of representing children and children in foster care, children who might be facing mental health issues and challenges in their life is very near and dear to my heart. I thank God every day for my grandparents for taking me in and raising me and giving me the opportunities that I have now. And I appreciate all that you're doing to advocate on behalf of children in Illinois. I can say from experience and my church was very important to me. I was raised again in Waukegan. I went to Redeemer Lutheran Church and was very active as a member. And it was a place of support and solace for me growing up as a child. So thank you all for what you do. I think Senator Fine hit it on the head. I mean, establishing a relationship with your legislator before you need to ask them for something or before you decide to engage on an issue is really important. I think there is this misconception that somehow legislators or elected officials are on a different plane of existence than ordinary people, and we're not. We're just people who decided to run for office and got elected. We're just like you. We're just like everyone else. And establishing that, so people should not be intimidated. They shouldn't feel nervous about coming to our offices, coming to events that we host in the community, and establishing a relationship can be incredibly useful, when there's an issue that comes up that you feel passionate about. And I think Mitch expressed it really well. The stories that you tell, the human touch, the human experience, why an issue matters because of a story or something that happened to a person in your community or what you're trying to change that you're going to try to affect that has a positive impact on people's lives is incredibly important. So all the things that you've already talked about, mentioned tonight are all great strategies for advocating for issues that we care about and that you care about.
Thank you. Yeah, that human touch means a whole lot. So you heard them, folks. Treat your representatives as humans, but bring your human stories too. The next question is, what do you think the outlook is around youth mental health services legislation? And what legislations might you be working on this session that's related to youth mental health? And in parentheses, I have in there, given the constraints, like budget things.
You want to go,
And I'll
Laura?
invite you to unmute. I'm sorry.
I'm sorry, I press mute, not knowing I'd have to unmute again, technology.
Right.
So I chair the Behavioral and Mental Health Committee in the Senate, and we have a lot of challenges ahead of us. We have come so far when it comes to mental health in Illinois that we have to keep on this course and not go backwards. I want to tell you a little story about how impactful a personal story was and where we are with mental health in Illinois, especially for children. The Mental Health Committee, and myself in particular, had heard from a number of parents who had children who were struggling and could not find placement for their children or help for their children. And they were not safe in their school, they were not safe at home, and the parents could not find them the help that they needed. You'd call places, you'd call doctors, nobody was there or available. So, as a committee, we did something called a subject matter hearing. And in this subject matter hearing, we brought in the experts and we brought in the families. And the families told their stories of what their struggles have been, and the experts listened, and the legislature listened. As a result of parents willing to come out and tell us their stories, and understanding that this can be painful and this can be difficult because these stories are very raw and very personal, but the impact they had was just absolutely amazing. So the state of Illinois listened and we got on it, and we started something called the Children's Behavioral Health Initiative. We started working with University of Chicago and Dr. Dana Weiner to study what is taking place here. What are the roadblocks we have in place? And then through her work, we developed a public-private program with Google. And this is called Beacon. And Beacon just kicked off a couple of weeks ago. Now, if a parent is struggling with their child, all they have to do is go online to Beacon and type in what they need, and they will have responses for what help is available out there for their child. If we did not have these parents willing to come forward, we would not have been able to make this progress because we would not have been aware of what the problems are. So that's why your personal stories are um, so intentional and so important, and so it will make the difference in the person's life who comes after you. Uh, with that, I'm going to let Anna talk a little bit now because you've heard from me a bit, and then I'll ping pong back in, but I'm not turning mute back on.
Sorry. Um, Senator Fine is such a champion in this space, and she's done so much work as the chair and just even before that from the beginning on mental health. And Beacon is a great is going to be a great resource for families. She's also done a lot of work in the insurance space, and I was able to work on an insurance bill last year that bans prior authorization requirements for mental health when people are seeking mental health services in a hospital. So we're hoping that that's going to help families who are having severe mental health crises and need acute care in a hospital, not have to go through the hurdles of, getting rejected by an insurance company or having to get prior authorization from an insurance company before you can seek or have that care in a hospital. Under the bill that we passed last year that Senator Fine was also a huge champion on, you get at least 3 days in the hospital before an insurance company even reviews your stay there. So there are a lot of different places that we're trying to impact and improve the care that families are receiving. Funding is incredibly important, whether it's through Medicaid or other types of programs that are available in the community. Also insurance reform to make sure that people are not denied access to mental health resources and therapies and care because of insurance reasons. And we also need to increase the workforce that's providing therapy. And that's another area that we're looking at in terms of increasing reimbursement rates for therapists and having that workforce in place. Mental health in schools, increasing funding for mental health access in schools is also very important. Similar to what some of the student advocates were talking about earlier. So there's a lot of areas that the state has been very active in the last several years to try to bring greater resources to families, because we know, especially after the pandemic, there are huge needs and a lot of kids are in crisis, and we need to be there to make sure that they can get through those difficult times and come out and live happy, healthy lives.
I'm going to jump on one more thing that Anna said, and what she did with eliminating prior authorization was Herculean to be able to get that done in the state of Illinois to help the people in our state. But what we do know also is if there are not people in the workforce, no matter who needs help or how, what laws we pass, if the help is not available, the help is not available. So a couple of years ago, we passed the Behavioral Health Workforce Initiative. And right now we are in working groups that are formulating what this initiative is going to look like. And it's going to be housed in Southern Illinois, and I believe possibly on the U of I campus as well. And this is going to be an initiative to get people to go into the mental health fields. We're looking at, what are the structures around this going to be? How are we going to encourage people to take this path? Is it going to be tuition reimbursement? Is it going to be more recruiting? So these conversations are happening right now, and we're hoping to have this up and running so that our workforce can meet the needs of the demand that's out there.
Well, that really ties into the next question, because I want to say, how can we be champions for you? How can we advocate for you as your constituents? So, in three parts, what are your priorities impacting youth mental health? And it sounds like we're hearing that. And what are your constraints for increasing resources, both monetary and physical? And finally, how do we serve as your advocates for you in your work?
Well, I think, programs like this are incredibly important. The organizations that you're representing do a fantastic job of educating us and coming down and telling those stories, and they're very important. I'll be very frank. At the state level, you have support. I think we've seen the legislature, the governor, all the different elements coming together, since we've had the administration that's in place right now and the leadership that we've had right now in the House and Senate. We've seen a priority placed on mental health and human services and uplifting families. The biggest threat right now is the federal government. And I worry about cuts that are coming down that are going to affect Medicaid reimbursement rates. I worry about, all the myriad, executive orders that are targeted at equity and diversity and inclusion, areas that we know are still problems, inequities that we still have in our state, communities that are still impacted, overly impacted by mental health problems, health disparities. We've been leaders in making sure that we are bringing in more resources to help with social determinants of health, like mental health and overall health. The state of Illinois, we applied for an 1115 waiver last year, and we were approved by federal CMS for a novel program which would bring in additional resources for nutrition, job training, housing, the supports that people need to lead healthy lives in the Medicaid program. And now we're worried that that's going to be reversed because of this new administration. So I think reaching out to your federal legislators is going to be very important as well. We know that even red states are going to be impacted by changes that they make to Medicaid. So we're hopeful that that will, slow them down or at least perhaps reverse some of the, cuts that they want to make. But just as Mitch showed in one of his slides, they're looking at trying to pass big tax cuts for wealthy taxpayers in March, and that could come at the expense of all of these programs that help us maintain programs for people who need it. Illinois, our Medicaid program is a 50-50 program with the federal government, and if we lose that match, or if they decide to pull back on the Medicaid expansion program that we're part of, we could lose 770,000 people off of Medicaid insurance program. And that would be a huge impact on families. So I think, continuing to reach out to state legislators and tell your stories about why these programs are really important and why we should maintain funding for them is really important. I think that that work needs to continue, but we really need to focus on the federal and letting our federal legislators know how important Medicaid is in funding these mental health programs in Illinois.
Thank you so much.
And I would 100% agree with what Anna said on that. In Illinois, we have been working on it. The fact that we have standing committees in both the House and the Senate that focus solely on mental health means that we have a state that's very serious about how do we approach this issue and how do we make sure that people get the help they need. We do have parity in Illinois, which means when it comes to your insurance coverage, your mental health should be covered the same way as your physical health. Unfortunately, that's not always the case, but we have a Department of Insurance that is really out there to protect the consumer. And so they are on industry to make sure that that is the case. And in the past few years, they have fined the insurance industry hundreds of thousands of dollars because of the fact that they have not abided by parity. So they are watching out for us to make sure that we are getting the coverage that we need, especially because when you're at your lowest point, the last thing you want to do is fight with your insurance company.
Awesome. Thank you. And then finally, the last question that I have for you is what do you hear from your colleagues in the General Assembly regarding mental health?
Do you want to start, Anna, or do you want me to start? Or you're still on mute?
Oh, I'm sorry, Anna.
Sorry.
Okay.
I think that there's a lot of support for these for mental health. I think the outlook is good in Illinois. I think that people understand that mental health care is health care, and I really appreciate seeing the stigma um, slowly disappearing around this issue, from even when I was a young person to now, how I have two daughters, and both of them at various times have struggled with their mental health, especially during the pandemic. They were both in high school during the pandemic, and both of them had, asked me if they could see somebody because they knew that they were struggling. And, unfortunately, because of our insurance, we were able to find somebody to help them, and they were able to get the counseling that they needed. I don't remember that being a situation when I was their age. So we've made a lot of progress, and I'm glad to see that. And I think, especially in, our caucus and the Democratic caucus, there's a lot of support. And I think actually in all caucuses, there's a lot of support. What happens though, when it comes down to brass tacks is, who's supporting the budget and who's supporting, who's willing to support the revenue that we need to support the budget. So I think there's general support for mental health services, but it's things start to divide when it comes down to revenue and whatnot. I will say that the changes that we made to the insurance code that bans prior authorization did pass on a bipartisan basis. So there was bipartisan support for that, which is good news. But yeah, I think that as a society, we are improving when it comes to mental health. And I think, most people agree with us that these types of services should be funded. And you'll get a lot of support in the General Assembly with these programs.
Yeah, I always I challenge people who say, "Oh, Republicans and Democrats, they don't get along at all." I challenge them to come to one of my mental health committee hearings and tell me who's a Democrat and who's a Republican. Because we are, as Anna said, we are on the same page until it comes to funding.
Yeah.
And then it's almost a joke because we'll have this great program, and I'll say to my colleague, "I'm glad you support the program. Will you fund it?" They said, "No, but you'll vote to fund it." So, fortunately, we do have that super majority of both the House and the Senate, and we
Yeah.
have the governor's office. So we know these programs are important, and we do our best to get the funding that they need.
Absolutely.
This isn't
Can't take it
an
for granted,
approved
though. Can't
question.
take it for granted. That should always be something, if this is what you care about, if this is a priority issue, when you're talking to candidates at all levels who are running, you should ask them. It's not enough just to support it. You also have to support it all the way. And so I put that challenge out there too. Make sure that, people that you're going to support in upcoming elections are willing to go all the way to support these programs. And that includes funding them.
Absolutely. Yeah, I was just wondering where do Republicans believe funding should come from? Is it only private, or I don't know.
That's a good question.
Democratic votes.
Hard
Democrats. Okay.
to pin
That
them
you guys
down.
can take the blame for the budget. Oh well, okay. Because it's not fiscally conservative to take care of mental health. Okay, okay, great.
Well, and that is a question to
So
ask. That's a question to ask when you're going in and talking to your
And in my experience, in one of those pictures Mitch shared, there was me at the Capitol, and that was usually a question representatives put back to me. So where do you think, constituent, the money should come from?
Yeah,
So have an answer, friends, because they'll put it back to us too,
true. That's a good point. Yep.
have some ideas.
So
Okay, thank you
I
so much
think
for your time.
we have a couple of minutes to do questions and answer, Tim, with
Great.
the
I'm
senator
glad
and the
we're on time.
representative.
Uh,
Janelle sent me a question instead, so it's a little backwards, but her question I'm just going to read. Schools are often the front line for youth mental health.
Mhm.
We desperately need more social service staff who provide services to any students in need. Currently, social service staff only have a requirement to provide social work minutes to students with IEPs and 504 plans. Do you foresee any type of legislation addressing this issue? And this is Janelle Bledsoe with IEA something.
I have not heard this issue raised specifically, but it's something to consider if this is a problem.
One thing we're seeing now in some of the schools is we're actually, some of the schools are partnering with local hospitals to actually put a health center within the school. And many times those health centers are staffed with a psychologist or a social worker, or sometimes even a psychiatrist, so that those students do have access to getting care within the school. Because sometimes what we find, especially with students, is they are so busy that it's hard to fit one more thing into their schedule. And so
Yeah.
if they can see a health expert during their lunch period, during a study hall, that can make all the difference in the world.
I have a question that was sent in, Tim.
Great. Yeah.
Maybe it's in the public chat. I don't know if it was just to me or not, but it says, schools are often the front line for youth mental health. We desperately need more social service staff who provide services to students in need. Currently, social service staff only have a requirement to provide social work minutes to students with IEPs and 504 plans. Do you foresee any type of legislation addressing this?
Thank you, Abby.
I have, oh, go ahead, Anna.
No, I have not. I've not seen anything specific to this. No. Mm-mm. But again, if that's something that we need to look at.
And this is something too we have to be very concerned about at the federal level, because we do get money for our public schools from the federal government. And some schools can use that money in a discretionary way, and it could be to get a social worker in the schools. So we have to be very on top of what's going on to make sure we do not lose any of that funding.
Yeah.
We mentioned, Senator Laura Fine mentioned the Beacon program, and actually one of the ones heading that up, Dr. Dana Weiner, was the recipient of our Children's Advocate Award from at our event in the fall. So I'm going to segue and turn us over to that Beacon portal training right now.
Welcome to Beacon, a new online portal that will make it easier for young people and their families to find behavioral health resources. In this video, we will show you how to use Beacon to find resources in your area. You decide how much information to share. It's always private. The more details you give, the better we can help you. If the youth who needs help is in crisis, please reach out to the Illinois Suicide Lifeline at 988 or another emergency resource. You will notice there are links to crisis services at the top of the beacon.illinois.gov site. If this is not an immediate crisis, please select Get Started. At this point, you will be asked if you wish to share specific information about the young person who needs help. This is optional. If you choose not to share, you will still be able to get a list of resources. If you do share, then our staff will help connect you with resources that meet the needs of the youth who needs help. At this point, you will have the choice to create a password-protected account. With an account, you won't need to resubmit the same information every time you use Beacon. Your information will be safe and easy to access whenever you use the portal. Next, you will be asked for basic information such as the child's name, address, date of birth, parent or caregiver name, who has custody of the child's school district, insurance status, to name a few. This information will help the team to find the services you need. The first step is to provide the child's age. If the person you're trying to get help for is between the ages of 5 and 18, Beacon can provide a list of state and community programs that can help. In some cases, youth are eligible for youth services through age 22. If this is the case, Beacon can provide some recommendations as well. Children under age 3 will be referred to infant and early childhood services. For children ages 3 to 5, information on local school district behavioral health programs will be provided. Anyone over 18 and not eligible for youth services will receive information about adult programs. Once information is provided, these cases will be closed in the portal. You will be asked if you need additional assistance. If you say no, the case will be closed. If you say yes, you will move to the next step. Here, you will be asked if it's okay to share the child's information with the resource coordinator. Resource coordinators make referrals and connect families to programs that meet their child's needs. If you do not want to share the child's information, Beacon will still suggest programs that may be a good fit. After you give the okay by signing a consent form to share your information, your case will be assigned to a resource coordinator. They will focus on finding more resources. If you need additional assistance, you can also request help from a parent navigator. Navigators have experience helping families to obtain services for youth, particularly if the youth qualify for school-based services. In complex cases that need help from more than one state agency, the resource coordinator may assign the case to a clinical specialist who will coordinate resources and ensure proper communication with the child's caregivers. Cases will remain open in Beacon until the child has been connected to an appropriate residential or community-based program, and the parent or caregiver will be kept informed at every step along the way. We are still hard at work building other parts of our system to make sure there will be enough services for everyone who needs them. In the meantime, Beacon helps you to find services and information for your family's needs while keeping your information safe. Try it at beacon.illinois.gov. At Beacon, we are creating connections for a brighter future.
Well, that's fantastic. Thank you. And so now I want to introduce to you a couple of representatives of NAMI, Illinois. Sarah Gray is the new executive director, and she's got more than 20 years in the field of education as a special education teacher. And her journey with NAMI began back in 2016. So she brings a lot of knowledge to us tonight. And also from NAMI is Tony Olhausen, the Director of Research and Policy over there. And his work has led to an expansion of mental health support on college campuses and ongoing reforms to the state's forensic mental health systems and a significant increase in funding for the mental health education and support. So welcome this evening, Tony and Sarah, if you could unmute yourselves. And yeah, Tony, I'd like to introduce you to go first. Tell us about some of the NAMI resources that we can be accessing.
Here we are. Thanks so much, everyone, for having me, and thanks to Senator Fine and Representative Mueller for being here and sharing all of your wonderful wisdom. So, I'm, as Reverend Beal said, I'm Tony Olhausen. I'm Director of Research and Policy with NAMI Illinois. I've been in the NAMI community for about 7 years now. I'm really excited to be here with everyone this evening. So I am going to share a little bit first. Oh, there I am. Just to talk a little bit about going back to effective lobbying and what makes an effective lobbyist or a lobbying visit. And there's been a lot of great information shared already, so I'll keep it brief to just a couple of quick points that we haven't heard already. So especially coming from NAMI and our perspective as a grassroots organization, folks with lived experience and family members, personal stories really make that a great impact for legislators in our experience. And when you're able to connect on that personal level, like Rep. Mueller and Senator Fine were saying, we find that most impactful. But I always try to remind folks that especially when it comes to if you're a parent or a sibling of someone with a mental health condition, there can be a lot of trauma, and talking about sharing your story and your experience can be really emotional and overwhelming. And it's always really important to remember that you're in control of your own story and your own narrative and what you share, how you share it. Being able to feel in that control, and really thinking carefully about what you want to share and how you want to share it, and how you can stay comfortable and confident in what you're saying while still making an impact. Especially when I get a little uncomfortable, I tend to drone on a lot, and just kind of keep talking, and that in a quick 3 to 5 minute meeting or 10-minute meeting with the legislator, that's using your time wisely is important to remember. So in that spirit, I'll keep moving along too. So I think that was really the main point that I wanted to kind of just add for folks. Excuse me. So I'm excited to have Sarah talk too a little bit about NAMI's programming and get a little bit into what NAMI is all about. So I'm gonna focus a little bit on kind of our policy issues and what we're seeing and what we're really hoping for in the upcoming legislative session, or not the upcoming, our current legislative session. Still getting in it, but so we especially when it comes to children and families, we've got a few bills that we're really excited about that will make accessing mental health care a lot easier. And our wonderful legislative speakers are mostly already sponsoring and supporting those bills. So it's really great to hear. So First, I wanted to talk just a little bit about HB 1448. I'll be quick because Rep. Mueller already kind of gave the overview of exactly what we hope to achieve with this bill. Her legislation from last session that eliminated prior authorization for hospital-based care, so inpatient behavioral health care, is amazing. It's a huge win, and we're I think the first state to take that step in getting rid of prior authorization to ensure that people can access mental health care when they need it on an inpatient basis. But we're really excited to try to take that next step, and apply that ban to all mental health or behavioral health treatment, regardless of setting, regardless of age. So HB 1448 and Senate Bill 1603, which was wonderfully introduced by Senator Fine. So she's leading that bill for us in the Senate, and Representative Syed is our champion in the House. So we're really hoping that the General Assembly, kind of continues the momentum of, and their commitment to expanding access to behavioral health treatment, especially, when it comes to administrative barriers like prior authorization that really limit access, and even a 2 or 3 day wait from the time that you and your provider identify that you need an IOP, or you need to increase your level, or your level of therapy, or enter into a partial hospitalization program. A couple days can make a huge difference in your life and your outcomes and how you're feeling. And Reverend Beal, feel free to stop me if you have any questions or want me to keep me moving along. So.
I'm actually taking notes. Thank
Okay,
you so
great.
much,
All right,
Tony.
cool. Yeah, making
Yeah.
sure we're on. And the other bill that I think is really important, that we're supporting this session, that I want to touch on tonight, is House Bill 1085, and that bill is also Senate Bill 55. Representative LaPointe leads that House bill, and Senator Villa leads the Senate bill. Excuse me, and both Representative Mueller and Senator Fine are already signed on as supporters. So thank you again to them if they're still hanging around. But we know that for commercial, particularly for commercial insurance, I have commercial insurance that's regulated by the state. I'm sure many of us here also have that. When you're looking for a provider, I always go just straight to the Blue Cross website and look at their provider directory. But you can find there's a whole list of folks that pop up. But there only some of them might be accepting new patients or have availability, and maybe you're looking for a particular type of provider or a provider with particular expertise, but that doesn't mean that your network has it. And especially as I think as time goes on, we're seeing that networks of behavioral health providers are getting smaller and smaller. And I think networks overall are getting smaller and smaller in insurance. And that's a huge problem. We already know that we have a shortage of mental health providers that accept insurance. I think it's like a quarter or a third of behavioral health providers don't accept any insurance and only accept cash payment or work outside of the insurance system. So to combat that and grow our insurance networks for behavioral health care, these bills would reduce administrative barriers and for providers to join insurance networks, kind of getting around some of the roadblocks that insurers put in place on providers, and get rid of some of those excuses that they have for not expanding their networks, as well as making it more financially feasible for providers to be in a network. Data shows that in overall, psychiatrists under commercial insurance get reimbursed at a lower rate than physician's assistants for physical health. And I mean, psychiatrists have MD, they're medical doctors.
Right.
Physician's assistants, that's a master's level position. So we're having mental health doctors paid less than master's level clinicians on the physical health side. And that's nothing against physician's assistants. That's nothing against, folks that treat physical health. But, if it were many, I think, well, I'm not going to come up with an example and say something wrong, but, we wouldn't be having that conversation. It would, we would know that that's not right. And, it wouldn't be a problem. So, this bill would take steps to solve those issues. And I think for folks here, keeping your eyes on the General Assembly's website that Mitch had shared earlier is a great way to keep up to date. I'll also put our NAMI Illinois Action Center that I keep up to date with legislation that we support. Action alerts on what you can do to act. Calling your legislator, emailing your legislators, things like that, and then also for our newsletter as well. It's a great way to keep up to date on our advocacy work. So I think I'll stop talking and and Sarah, if you want to go ahead.
Absolutely.
Yeah, welcome, Sarah.
Thank you so much for having me, you guys. I actually finished my new hire orientation today. So I'm real new. I come from a local affiliate that served Kane, DeKalb, and Kendall counties. And I've been with NAMI for 4 years, and I've been with NAMI Illinois a week. I found my way to NAMI when my child had a mental health crisis in college. But I want to talk about the early childhood experience here, because when I was in college, my daughter was going to preschool, and I was called into the preschool's principal's office telling me that they saw some behaviors and some concerns. And I was referred to the local school district. And she was diagnosed with ADHD. And we just organically handled it. And then right around 3rd grade, we tried to introduce medication. It was disastrous. I mean, we had some psychosis, so we pulled off. Then in 8th grade, we tried medication. And in junior year of high school, my daughter came to me and was like, "Mom, I want to go to college." And we tried medication again. And each time, horrible response. And so we had gotten her an IEP when she was in 1st grade and tried to put as much support services as possible around her. My husband and I are both educated. In addition to being a special ed teacher, I had worked for Head Start for almost 15 years. And so even when you have all this knowledge and child development, it's still really hard. I mean, I really didn't know what to do. And it wasn't until my daughter had her first mental health crisis when she was at her local community college. She went to the guidance counselor and she expressed suicide ideation. And she thankfully gave permission for me to be notified. I left Head Start and met her at the ER. And with that depressive episode, she was diagnosed with bipolar 1. Now, hindsight's 2020. I mean, I just wish that we had gotten her the support and the help that she needed earlier. We were treating her from the lens of ADHD, and she struggled all the way through school. And we worked diligently, her father and I, and we paid for all the psychiatrists and this talking therapy. She did it all, and it still was so hard. And so I'm really excited about the tone of this conversation. I'm really excited that this is a strategic goal for NAMI National and for NAMI Illinois. We do ending the silence in middle school and high school, where we go to schools and we talk about the red flags. We do them for parents, we do them for staff, we do them for students. We also do NAMI on campus clubs. They had started on college campuses, and now we can hold them at local high schools. Some of our affiliates do middle school and high school groups. And so I'm really, really excited that we're all here trying to advocate for this, because data shows the earlier the intervention, the better the outcome. And there's hope. NAMI believes in hope. I mean, one of the reasons why we tell our stories and we're vulnerable is because we want to move the needle. And what I'm really excited to report is now my daughter at 29 is at NIU and living in a dorm and has a job. This is a child that rotated in and out of the hospitals 6 times her first 2 years with her diagnosis. I didn't even know if she would be able to make decisions and caretake for herself. And here we are, right? So we do know that intervention changes lives. And why wouldn't we want this for all of our children? And we know we have to do for the whole family. So not just children, but the whole unit. I mean, that if we help the family, we help the child. We know this. So, NAMI Illinois is a statewide organization of the National Alliance on Mental Illness. We're an alliance. We're a grassroots network. And we're working with individuals that have symptoms or a diagnosis and their families. And we're hoping to challenge this stigma and advocate for stronger, more inclusive mental health systems. We support over 50,000 Illinoisans with high quality research-based education, support groups, advocacy programs. We do community presentations. All NAMI programs are free of charge and without eligibility requirements. One of the roles of NAMI Illinois is we train for free community members all around our state so that they can provide in their own community support groups, mental health education, and community presentations. So I attend, when my daughter had her hospitalization, she went into Mercy Hospital in Aurora, but afterwards, I'm actually in the University of Chicago right now. My husband works out here. Our aftercare was at the University of Chicago, and they gave us a folder about NAMI, and my husband and I took the family support group. So I'm a consumer. I took family support group, and I took the family to family class. And then we do ending the silence, which I talked a little bit about. And the goal is to teach family and children about mental illnesses and provide tools for navigating this, and to have peers that have gone through this experience to walk beside them. And we know that when peers are involved and can talk about their experiences, that it's really helpful. I can speak to when I went into my first class, I learned about special needs trusts and different things that I put in place in my own life from talking to other people who had been through the same experience.
That's really good. Yeah. We're going to wrap up the formal portion of our program. And thank you, Tony. Thank you, Sarah. I mean, what you shared just really speaks to the youth videos that we heard. Like,
Yeah.
the people didn't understand what I was going through, and these were supposed to be my counselors. And what I'm hearing from so many of us here is our personal lives have been touched by mental health needs, and that's why we want to be support. So, yeah. So we are all advocates. I know 45 years ago when United Voices for Children was established, we wanted a child advocate in every church, someone to say at those board meetings, and not just like a Sunday school or a child educator, but an advocate. How are the kids in our neighborhood doing? How are the kids around our church doing? beyond these walls and within them, and to really get serious about the needs of children as well as their mental health. And I think we've pivoted. We feel like every United Methodist should be a child advocate. And that's why we're offering this today. We had 70 signed up for it. At one point, our high point, we had over 52 here. Thank you, participants. Thank you for attending. The UVC website's got resources. I just want to say thank you to everyone who was here tonight. At this point, I'm going to turn it over to Tasha.
Thank you, Reverend Beal. Good evening, everybody. I am Dr. Tasha Green-Cruzat, and I'm president of Children's Advocates for Change. So as we close today, I want to take a moment just to reflect on the incredible power of partnership that has brought us all together here tonight. At Children's Advocates for Change, we firmly believe that advocacy is not just a solo endeavor. It is a collective effort. It's a shared vision. And our partnership with United Voices for Children exemplifies just how transformative that shared mission can be. Together, we are building relationships that matter, relationships with one another, with the communities we serve, and with the policymakers who hold the power to create meaningful change. By pooling our resources, our voices, and our passions, we amplify the impact we can have for children and families. This work is not easy, and the challenges we face are significant, but I am reminded every single day that we are stronger together, and I will repeat that we are stronger together. And when we unite around a common cause, there is just no limit to what we can all achieve. So as we move forward with this incredible work, let us continue to lean on one another, to build bridges, and to ensure that every child has the opportunity to thrive. Thank you for your partnership, United Voices for Children, your dedication, and your unwavering commitment to this important work. Together, we are truly making a difference. So thank you.